Hi, I'm Jennifer Smith.
And I'm Melva Jones.
And we are Women's Health in Black and White. Today we're going to talk about sexually transmitted infections. The term that was used in the past was sexually transmitted diseases, but not all of these produce symptoms that you would recognize as a disease.
Yeah.
So we've changed it to sexually transmitted infections.
Right.
And there's a lot of them. I'm so sorry. It's just part of life, but there's a ton of them. So I've written them out, and I started writing them in alphabetical order and then got off track, so we're not going to do them in alphabetical order.
That's impressive.
We're going to break them down to the ones that are bloodborne, that you will, to be tested, you have to have your blood drawn, and the ones that to be tested, you get a little swab. There is something called cankeroids. Cankeroids are painful ulcerations caused by a bacteria. It's not very common. If you have one, you will know it.
Yeah.
They hurt. And they look like an ulcer. It looks like a circular sore with a caved in part at the top, and it usually has some discharge coming from it. It's sort of mucousy, bloody, and very painful, and it is healed quickly with an antibiotic, but you have to let us know. They are highly contagious. The good news about cankeroids is not only are they pretty rare, but they don't have a lot of effect on the rest of your health. This isn't one that's going to cause problems for the rest of your life, like some of the ones that we'll get to. The two big ones that I think people know from media and from maybe history are gonorrhea and chlamydia, commonly called the clap. Gonorrhea is a particularly bad one right now because there are strains of gonorrhea that are resistant to antibiotics. So there is super gonorrhea.
Right.
Yay! Both of these are bacteria. They can both be treated with antibiotics if we know that you have them. Here's the really bad thing about gonorrhea and chlamydia. Women are very frequently asymptomatic, which means you don't have discharge, you don't have pain, you don't hurt, you don't run a fever. There's no reason for you to think that you have it. And if it goes untreated, it can prove extremely dangerous for your health. It can lead to something called pelvic inflammatory disease, which can cause a serious infection that may even kill you. But it can also cause scar tissue along the fallopian tubes, damage to your reproductive system, and it can mean that you will never carry a child. So these are things that we need to know about, and you should be tested for them. If you are sexually active, you need to be tested annually for gonorrhea and chlamydia. Honestly, even if you're in a long-term relationship. I want you to trust your partner. I hope you do. But I don't. I want to test you. If you do have symptoms, it's going to be cervicitis, which means your cervix becomes inflamed and infected and you might bleed, especially after intercourse. So if you have bleeding that you weren't expecting after intercourse, please let me know that. You can have chlamydia or gonorrhea infection in your urethra, so it might burn when you pee. We'll definitely check for that if you come in with urinary symptoms. Now, very frequently, a woman will come in and say, I think I have a urinary tract infection, or I think I have a UTI. And what she's talking about is something entirely different. She's talking about discharge. Right. She's talking about urinary tract infections is burning pain with your urination, or an achy, crampy pain where your bladder is. Those are the symptoms you're going to feel from that. If it becomes a kidney infection, you're going to have lower back pain, chills, and fever. But the other infections in your genital area, things like that produce discharge or sores or itching, that's not a UTI. That's another kind of infection that needs to be explored. You can have gonorrhea and chlamydia infections in your throat. That's important information. If you get a really bad sore throat and you've been sexually active with and having oral sex, that needs to be tested for too. Both of these infections can cause huge problems during pregnancy, preterm labor, premature rupture of membranes, intrauterine growth restriction, which is low birth weight, and they can lead to problems even after delivery. Babies born to women who have gonorrhea or chlamydia infections at delivery can have blindness and other really, really bad things. So that's one of the reasons that we test you in pregnancy. If you have any reason to suspect that you might have been infected with one of these things during your pregnancy, you need to tell us right away. These are things too that are reportable to the health department. That's important information for you too. If we confirm that you have gonorrhea, chlamydia, syphilis, we are required by law to report that to the health department, and the health department will contact you to make sure that your partners have been notified so that everyone can be treated. Syphilis is one of the ones that is tested for with blood test, but you can have a sore vaginally, which is why I'm including it here. A syphilitic sore is another ulceration. They usually don't hurt real bad, and you can miss it.
Yeah.
You might get one and never know it, which is why a lot of patients who have syphilis are not diagnosed by these little sores. They're diagnosed by which is primary syphilis. They're diagnosed by secondary syphilis, which can cause sore joints, a rash all over your body, and a low-grade fever. But even secondary syphilis, some people miss.
Yeah,
some people just write it off. It's just a normal ache, pain, flu, whatever. And a lot of people that get diagnosed with syphilis would never report to you that they had symptoms. Right. They just walk in for a prenatal exam, and we test them, and sure enough, they've got it. And these three infections, gonorrhea, chlamydia, and syphilis, have all increased exponentially in the past 4 years. Yeah. Especially syphilis.
I know.
In this part of the country where we are, in the last 6 years, between 2014 and now, the rates of syphilis have increased more than 38%. It's been an enormous increase. And this is another one that can affect your baby in very, very negative ways. In fact, the current recommendation is to test you for syphilis at least twice during your pregnancy because it can be so damaging to your baby. So everyone gets tested at their first visit, and everyone gets tested at 28 weeks. It can cause premature labor, premature rupture of membranes, and even after delivery, if your baby manages to make it to term and you have a healthy delivery, your baby can have multi-system organ failure caused by congenital syphilis. So it is a huge deal, and we need to test you for it. Trichomoniasis is another vaginal infection. This one is symptomatic, which is kind of nice actually. Yeah. It produces a discharge that is frothy, bubbly looking, either yellow or greenish. It is.
You definitely, I understand, you can't miss.
And there is a very characteristic and very noticeable fishy smell associated with trichomonas. Yes. And bacterial vaginosis, another vaginal infection. The test for trichomonas is a swab and then look at it under the microscope. So if you have any issues with discharge, itching, strange odors, anything new, it needs to be checked out, especially when you're pregnant. Anytime, but especially when you're pregnant. Bacterial vaginosis with that characteristic fishy odor isn't exactly a sexually transmitted disease, but you are more likely to get it when you're having sex. And it can be sort of passed back and forth between partners, especially if your partner is uncircumcised.
Right.
Yeast is another potential vaginal infection. It is not technically sexually transmitted, but you're more likely to get it if you're having sex or taking an antibiotic, which is what does it to me. And it, again, can be passed back and forth between your partners. The important things to know about these vaginal infections is that if you have one of them, like bacterial vaginosis, trichomonas, yeast, any of these bacterial vaginosis and trichomonas can cause preterm rupture of membranes and preterm labor. Yeast cannot. But any of these three can cause more tearing during delivery. If your tissue is infected and there is strain on it because of this infection, it's less likely to be elastic and you're more likely to wind up with stitches. So that's another reason that we would like to keep that from happening while you're pregnant. The blood-borne pathogens that we test for are hepatitis B and C most commonly, syphilis, again, because you're likely to miss that little canker sore, HIV, and herpes can be tested for in the blood as well. Of course, the big thing about HIV is that it can kill you. This is something that you will not get rid of. There is no known cure. We can manage the symptoms, and we can manage transmission to your baby. We can keep the transmission rate under 2% if we know about it early and treat you appropriately. Hepatitis B and C are both infections of the liver, and you catch them through blood contamination, contaminated blood, IV drug use, and of course sex. And again, if we know that you have it, we can keep your transmission to the baby at a minimum, and we can keep your symptoms under control. And we can keep you as healthy as possible. This is why we test you for these things. I want to mention too, Zika virus. It's still a thing. In the middle of this pandemic, some of us have forgotten that Zika is out there.
Yeah.
But it is, and it can cause problems with your pregnancy. And I'm listing it under sexually transmitted diseases because it has this very curious element to it that it can be found in sperm, which means your partner can become infected with Zika, which is an upper respiratory infection, recover, and during that next year, an entire year,
Oh, wow.
can pass it to you through sperm. And the big problem with Zika, it's a very mild upper respiratory infection. People recover from it just fine.
Yeah.
But it causes congenital malformations in a pregnant woman.
Right.
So if you are pregnant when you catch it, it can be very, very, very bad for your growing fetus. So that's the reason I mentioned it in this list. Sexually transmitted diseases carry a lot of stigma. I don't care about that.
Yeah.
I don't care who you slept with. I don't care when you slept with them. I don't care how many times. I don't care how many partners.
Right.
I care about keeping you and your unborn child as healthy as possible. So that's why I test. That's why we ask questions about it. I don't mean to be intrusive. I have no intention of causing you to have shame for any of this. I just want to keep you healthy.
Yeah.
So when you come in, you will be tested for these things and we will treat you appropriately. Did I leave anything out?
No, just interesting. I did not know that the Zika virus, it could be found in sperm a year later.
A whole year.
That's new for me.
Yep.
I knew about the congenital, all that stuff. I just didn't know about the sperm part. That is crazy.
It is very important.
Yeah, that's important.
And we live in a very travel heavy world.
Mm-hmm.
You know, I've had patients whose husbands have been to Africa
Yeah.
and South America during the
Right.
course of their pregnancy and have had to say to them, you got to use condoms for the rest of the pregnancy.
Yeah.
Just to protect
Just
the
for
baby.
safety. Right.
Yeah, it can be a big deal. If you have questions about any of these things, if I haven't covered something and you would like me to, if you have a story you want to tell me about any of this, find us on social media. We've got a Facebook page, Twitter, Instagram. We've got a podcast called Afterglow where we talk a little more informally about stuff. And we're interested in your comments. Like and subscribe, comment to let us know. Have a good day.